So now my patient has undergone induction. We're just going to go ahead and adjust the vaporizer in O2. Just going to turn him to 2.5 and of isoflurane, and then about 1 liter of oxygen. Just adjusting as we need to for his depth of anesthesia that he's in. So now what I'm going to do is just verify that he is breathing and listen to his heart and get a heart rate. Okay, so his heart rate's about 90, which is good. So we're just going to go ahead and lubricate his eyes. Okay. And so now that it is all taken care of, I'm going to go ahead and just start hooking him up to our monitors. So the first one I'm going to hook him up to is our SpO2. And this just monitors the oxygen saturated hemoglobin. Usually you hook that up to like a nice pink fleshy part of the body. We like to use the tongue. You can also use ear on him too. You could also potentially use a prepubes. So I got that hooked up, and it is about 96%, so that's good. So now we're going to go ahead and I'm going to hook up his capnograph and respiratory monitor here. And just get that hooked up and wait for a reading. So I have a reading for my capnograph, the end tidal carbon dioxide. It's about 35 millimeters of mercury, and his respiratory rate at the moment says, waiting for it to get a reading, says about 14 breaths per minute. So now that I have that hooked up, we're just going to go ahead and I'm going to hook up a blood pressure. I'm just going to hook it up on his forearm with not on the catheter side. Just going to secure this cuff here with a piece of tape and go ahead and get a reading on that. And while that is getting a reading, I'm going to go ahead and hook up his ECG. So my leads, I'm going to do white on right and do black on left, or as I like to remind myself, smoke before fire, because then the red is considered fire, and that goes on the back left. We're just going to wet that down here with some alcohol. And I'm still getting blood pressure reading. Go ahead and wait for my ECG to go ahead and set up. While I'm doing that, I'm just going to go ahead and manually bag him. Give him a breath here. Go to about 15 centimeters of water and open my valve there. Okay, so it looks like I have blood pressure that is 97/70 with a mean of about 74, so that's a good reading there. And so the last thing I'm going to set up here is my fluids. And also at this point, if we had an esophageal stethoscope, we would place it at this time. Basically, it's a long tube connected to the head of the stethoscope that you place into the esophagus, and it's close to the heart, so it gives you a nice clear sound of the heart to take a heart rate. So I've got his fluids hooked up here. He's about 200 mLs an hour of fluids. And so what I'm going to do is just kind of, again, just verify that everything is hooked up and it looks okay. Let's go ahead and kind of get some of these wires out of the way. Everything looks good. I'm getting good readings. So at this point, I'm going to go ahead and start recording my readings. And we're going to record a reading about every 5 minutes during the procedure. So I'm going to go ahead and do that now. I'm going to write my time down. And my heart rate. So I have a heart rate from my ECG, and it's about 90, which is what it was when I was listening to him. So he's staying stable. I'm going to go ahead and just check his mucous membrane color. It's nice and pink. You get a capillary refill time, which is about less than 2 seconds. His blood pressure. His respiratory rate is about 14. His end-tidal carbon dioxide, his SpO2. Fluid volume, and he is on a warm water circulating blanket as well. But I'm just going to go ahead and also check a temperature on him. So I have my thermometer here. My temperature is about 99.9 degrees Fahrenheit. I'm going to record my oxygen flow percentage and my ISO. And so now I'm just going to go ahead and just cover him with a blanket, just to keep him comfortable. And again, I'm just going to manually bag him. Open my pop-off valve. So we'll continue to monitor for about every 5 minutes, just again checking heart rate, respiratory rate, SpO2 during the entire procedure, manually bag him, check his temperature, and just overall make sure everything is okay. We will slowly start to decrease him as his level of anesthesia gets a little bit deeper, and then we'll decrease him over time too as we get towards the end of the procedure. So my doctor has pretty much finished her procedure. She's just kind of going to go ahead and finish examining the patient after she's finished her procedure. So he's been really stable. We've been monitoring him about every 10 minutes, taking all of the vitals. End-tidal carbon dioxide has been good. His SpO2 has been good. His heart rate's been stable. He's been getting fluids at 200 mLs per hour. And at this point, he's almost finished with them. It's a relatively short procedure from start to finish, and everything has been okay. He's been on his hot water circulating blankets, and so what we're going to do, he was on 2.5, and we've turned him down to 2. So he's been on 2 for a few minutes, so we're just going to slowly turn that down to 1% isoflurane, and then his oxygen has been just above 0.5 for the procedure, and we're just going to keep it at that for now. And we're just going to continue to just record our vitals on our anesthetic form here. So I'm just going to continue to monitor those while she's finishing up. So right now his heart rate is about 90. SpO2 is 97. His end-tidal carbon dioxide is 36. His respiratory rate is 12. Blood pressure is 122/82 with a mean of 72. So I'm just going to check a temperature here. I'm just going to check this mucous membrane color. Looks good. This capillary refill time. This temperature is 100.1. So I'm going ahead and record that. just kind of continue, just overall look. Everything's looking okay. Going to close my pop-off valve, squeeze my bag to about 15 centimeters of water, and open my pop-off valve. And I'm just kind of watching the waveform for the end-tidal carbon dioxide monitor. So we're also looking at the wave pattern for the heart rate and the SpO2 and the end-tidal carbon dioxide. Just want to make sure that everything looks normal. We don't see any abnormalities. And so far everything's looked okay throughout the procedure. So we're just gonna sure, and I'm just gonna go ahead and I'm just gonna turn him down to about 0.5% ISO. And I'm gonna keep him there for about a minute, and then we'll start disconnecting his monitors. While I'm doing that, I'm just going to go ahead and get a heart rate. Okay, so his heart rate's about 92, which matches my monitor here. Alright. So now at this point, we're just going to go ahead and start disconnecting him. So I'm just going to remove this blanket here. Let's put it over here. And I'm going to take pretty much everything off except I'm going to leave my capnograph with my respiratory monitor on it. And I'm going to leave my SpO2 monitor on it as well because that can give us a heart rate. So I'm just going to go ahead and take his ECG off. Here. Take his blood pressure off. And then we'll go ahead and disconnect him from his fluids. Cap is one. Put his cap back on him. Let's cover that back up. Okay. We'll go ahead and just get this out of the way here. So everything's looking good. His heart rate is increasing a little bit as we've been turning him down from the ISO. So it's about 96 now. SpO2 reads about 98, so that's what we like. We like that also to increase. The end-tidal carbon dioxide is about 35, and respiratory rate is about 16. Just gonna keep him here for a little bit. So now he's been on 0.5 for a little bit, so I'm just gonna go ahead and completely turn his ISO off. So now he'll just get pure oxygen. I'm just going to take a listen. Okay, everything is good. His heart rate now is about 99. So what we'll do is just continue to recover him on oxygen, and we'll start to recover him, and I'm going to continue to record those vitals, including temperature, until he's fully recovered, and that's it. The anesthetic procedure has been completed. We're just going to go ahead and clean and put away our monitoring equipment, it's very important to make sure that everything is disinfected properly and put away. That way it's ready to be used for the next procedure, and you don't have to worry about any kind of contamination or any corroding or damage to the monitors themselves. So first thing I'm going to do is I've got my cloth and I have my disinfectant here, and my disinfectant per manufacturer's recommendations is safe to use on monitoring equipment, such as you have to be careful with wires and some of the other kind of exponents of the systems, just to make sure that it is safe. So neutral pH cleanser is best. So what I'm going to do is just go ahead and spray my cloth here. We never want to spray it directly onto the monitors. Again, with the wires and the different components, it can cause some damage. So I've got that nice and clean. I'm just going to set that aside. So we'll start with my SpO2 here. First, I just want to make sure that it's not tangled up. And I'm just going to go ahead and just take the cloth, the part where it's saturated, and just wipe it down really well. Just going to get in all these little grooves here. You can even take the clip part off. It's really important to make sure I get everything. Sometimes blood can get on these and other debris. So it's really important to make sure you get everything. So I have that. Now I'm just going to kind of go down the wire as well. The wire can also become contaminated with blood and debris. Just going to kind of wipe down everything that we can here. So now that I've cleaned that up, what I'm going to do is just make sure that I coil it up really well. We just store ours in an overhead cabinet. We don't have a tray that we put it on. So I like to make sure that everything is nice and coiled, just to prevent damaging anything in the wires, which is very common. And also to get everything all tangled up, because after you pull it down, you would hate for everything to be tangled up and you have to untangle it again. So I've got that. I'm just going to kind of set that to the side. I'm just going to get my capnograph respiratory piece here. And again, just kind of wipe down this part, making sure I get the inside of the tube as well. Very carefully. Again, on both sides. Wipe that down, and then kind of go down the wire part down here as well. Just kind of pull that along. And then again, same thing, I'm just going to very carefully coil this up. And most of these come coiled, so they already have kind of a natural form. So I just find it really easy just to don't force them to go in any certain form, just kind of let them go in their natural form the way they were packaged. So now that is done, I'm going to set that over here to the side. I'm going to get my blood pressure hose here and my cuff. I'm just going to disconnect my cuff. These are a little more tricky to clean. I kind of just spot clean these guys as needed, wipe down the hose, and this part is cloth and you can't necessarily wash this cloth. I just kind of wipe it down as I need to. And I'll set that aside. And for my hose here, again, I'm just going to wipe this down very carefully. Making sure I get everything. And then again, just carefully coil it up. as so. Just set that aside over here. And now I've got my ECG. So this one I cannot remove the leads on it, so I'm going to be very careful just to make sure I get all of the harder parts inside, the tighter little spaces in here. The inside parts of the clip as well. And again, just go down the wire here. And these guys, I really like to make sure that they don't get tangled up, because they can become kind of a pain to untangle. So again, I'm just going to clean this lead really nice and well, get in all the little nooks and crannies that bacteria likes to hide in. Last one here. Good job. There. So I'm just going to kind of lay these guys out straight, and for my ECG leads, just to make sure they don't get all tangled up, I like to put them on a tongue depressor with some VETT wrap wrapped around it and just clamp it on there as so. This just, again, just helps them from becoming really entangled while in storage. So usually what I'll do at that point is just kind of, again, just coil it up. And then I'm going to go ahead and wipe down the rest of the wire here. As you can see, it's really easy for it to get tangled up here. Alright. Good. I'm just going to go ahead and coil it back in its natural form here. Just as so. Kind of set these guys on top of each other there. And then what I'll do too is just go ahead and wipe down my monitor, just in case any kind of splatter gets on here. Okay, so now what I'm going to do is I'm just going to go ahead and put everything away. Just making sure you can see that. So I got my monitor. We just stick it up here in this cabinet. And then with all the cords and everything here, we just kind of stick them gently right next to them. And then we keep our cabinet closed. And then the door to our surgery suite is closed as well. And now that we're finished, that is everything that is involved in cleaning the monitoring systems after procedure. And that is it.